Welcome to Influential Entrepreneurs, bringing you interviews with elite business leaders and experts, sharing tips and strategies for elevating your business to the next level. Here's your host, Mike Saunders.
Hello and welcome to this episode of Influential Entrepreneurs. This is Mike Saunders, the Authority Positioning Coach. Today we have with us Ronald Flores, who's the founder and CEO of Curious Finance. Ronald, welcome to the program.
Hi, thank you, Mike. Thank you for your allowing me to be in the show.
You're welcome. I'm excited to talk with you, and I always love to learn new things with new people that I come into contact with. Before we jump into what you do and how you serve your clients, give us a little bit of your story and your background and how you got into financial services.
Yeah, so basically, I was in medical field that time. I was a nurse, working 60 to 70 hours a week, just trying to get by. And, that's the way Filipino it was built up, either you're going to be a nurse or an engineer. So I got into that industry and I thought that that's it. I'm done. I'm making money and I'm doing a good I did a good job in going to school, but when I saw all the people that become more nurse before me, they're struggling to retire properly because they don't really know, paying to my taxes or their retirement is not really properly set up. Even though some of the hospital or even the clinic have a good benefit for employees, they still don't understand how to apply to their life. So since then, I recognized that and try to talk to big financial industry companies that maybe they can teach me how to take care of my finance, but unfortunately that they don't really want to deal with people who just starting up with their finance. So from there, I try to learn my way to the financial industry. And after being in the industry for 10 years, 2017, I built the Curious Finance and see and find a solution for the gaps of nurses and doctors.
You know, what I love about that introduction is your entire focus is on serving and helping other people, from being in nursing and helping people with their health and working in that setting in the medical practice. And then you noticed something that when you wanted to get some help financially, it really wasn't there in the way that you needed it. And so you merged into financial services. And of course, you're now serving that same industry that you came out of because you can relate to that. So it's just really powerful to be able to notice that there is a gap. Like you mentioned, there's a gap in knowledge and there's a gap in retirement planning. So let's talk a little bit about your work with private medical practices. How do you first start working with them? What is the first place that you start in your service to them?
Well, basically, like I said, I've been I with them. When I started my practice, I didn't really let go of my nursing. I was trying to build up my confidence. Build up my my knowledge about finance because, as you know, doctors and nurses are very critical thinker. That's the
Yes.
best thing that I guess I learned from nursing is in the medical field itself. We are critical thinkers, so everything that you bring up to us or tell us, we need to analyze it with making sure that we're doing the right thing, asking people around us. So from there, I gain some trust of my nurses, and then my nurses talk to the doctors, and that's the way it is. It builds up from the momentum, and right, like I said, 2017, I decided to build the Curious Finance because I see that what I'm doing is the right way of helping the medical industry.
Yeah, and do you find that when you start working with someone in the medical industry, that there's typically a a common need? So, for instance, if someone is the owner of a medical practice, do you start working with them on lowering their taxes, or do you start working with individual doctors on planning for their retirement? Where's the first place that you are noticing that the need is?
Where the need really is for the doctors, I see right even now is very prominent is the is really navigating the student loans that they had,
Mm,
uh, even the nurses who have that problem. And then the secondly is right, like told you in the beginning is the retirement, and then from there is the legacy. It's very important for us to, even though we're working so hard, we still have a chance to take care of our family. So that's the basically the three things that I see that always gonna be bringing up by the doctors and nurses is that three needs.
yes. When you work with someone in the medical industry, sometimes it would be a doctor or nurse working for a company, but then sometimes it might be the owner of the medical practice. What are some of the tax complexities that you advise your clients on, whether they are an employee or the owner of the practice?
Well, most of my client right now is the owner. So basically, the task strategy, efficacy. So it's not only by the number, it's not only, oh, the law was passed, oh, let's do this, basically the taxes are is there with for the the business owner or private practices. But like I said, how you gonna basically put this step by step or strategically putting it together so that it will be time lasting. If something will happen or something is changed in the law or change in the policy of the state or the state of the state, we still need to adjust on that. So the complexity of the taxes is really some of the things that we trying to make sure that it's not only according to what's the norm or what's is available for private practice, but is this the vision or the goal of the doctors are really consider so that it's really gonna be a time lasting the plan.
Yeah, I think financial resilience is so important to consider because here is the owner of a medical practice. They're trying to take care of their employees to
Hmm.
help them with their retirement planning and financial package. But then also the owner of the practice needs to do exactly what you just said. What are some of those challenges that you're advising your clients on regarding financial resilience and being able to bounce back and overcome these challenges?
So basically, the financial resilience that I always try to tell them is comprehensive planning and proactive planning with combination of that. And this is not really me that saying this. This is what I learned researching this industry. Even though I'm came from that industry, not only me was saying that even the Precision Foundation reveals that 42% of the doctor expressed concern of financial viability. Basically understanding the common mistakes of the doctors or even some of the uh, uh, things that changed because of the COVID. There's a lot of things that changed during the COVID, like maybe the change on in deduction and credits. Retirement contribution, and even the healthcare related charges. That's only some of the things that I look for, making sure that the doctors are aware that there are some changes on this thing. That's why that proactiveness that we Curious Finance always apply on in any of our clients is making sure that they're aware of their the changes, so that we can adjust if this adjustment is this changes really will impact the not only the current and but the future situation of the doctors.
Yeah, that's a really big piece that you need to think about is it's almost like a seesaw. When you push down on one side of the seesaw, the other end goes up. So if you are making an adjustment on your finances, whether it's for your employees or your own retirement, you need to keep in mind what it's going to do to the other side of your finances. And it kind of reminds me too of like you mentioned in your career, you worked 60, 70 hours a week. That work-life balance is so important because while you are striving to succeed as a medical practice owner, you need to also have that time off so that you can enjoy your family. And then when you come back to your practice after that time off, whatever it is, day, a week, then you're recharged. What do you see in the industry as far as a work-life balance while running a high successful medical practice?
Well, thank you for saying that, Mike. Because like I said, I always try to be keeping up with the changes, keeping up with the not only the financial side of the industry, but the wellness side, because we're like doctors and doctors, they're trying to help other people to get well. So why not helping them too to get well? Because not only me seeing that, but the Medscop report that 38% of physicians struggle from burnout. So basically, that burnout is before was not really not it's there, but it's not really trying to emphasize on it. But now, because of the COVID, it says that the bring burnout in a practice is really there. Need to be need not only to be considered, but really take a point that we will look at the wellness of the physician, because if you are basically not you're stressed out, the mind is not working properly, because you're thinking about, instead of thinking about your your patient's situation, you're thinking about your finance. This is not only repair I was referring to, I saw a news or a article about by the Mayo Clinic that correlate with the balancing with the wellness, so that not only the patient of the doctor or the physician need to take care of that or look at that, because that can cause hypertension. It can cause different kinds of heart problem, different kinds of respiratory problem. But even the doctors itself, even though they're working, like you said, like I said too, 60 to 70 hours a day, sometimes they don't have time to breathe in or breathe out, trying to relax, right? So now they because of that different kinds of study, the some of the hospitals now are emphasizing, doctors cannot work too much, or if you're in your private practice, you should need not only look at watch out for your staff to being stressed out, but you yourself, you need to have some kind of relaxation, or some kind of traveling, or some kind of time to get out from the practice. Even 30 minutes a day, it will help you.
Yeah, that's a really big piece. And I would venture to say that there's, like you mentioned, so many studies that are around that, and you cannot be fully present to help your patients if you're not recharged. And you're not fully present with your family if you're not recharged as well. So having that work-life balance is so important. So what I would like to ask Ronald is, when wrapping up here in this conversation, what is a piece of advice that you would give a owner of a private medical practice when they might be listening to this interview saying, "Oh, I'm just fine in my retirement planning personally and for my practice." What are some of the things that are typically missed that when you come in and work with a practice that you're picking up on and helping them solve?
Well, thank you, Mike, for that question. I was kind of smiling over here because sometimes when I go to a position, sometimes a CPA or enroll agent or an accountant basically endorse me or recommend me to that doctor because they say the doctors are in positions kind of saying that, oh, I'm only a W-2 employee, or I'm only I'm not really making that much money because I'm in the private practice. My taxes are simple. My tax plannings or my financial planning is simple. But yeah, it will might be simple, but the how much are you paying in taxes? How much are you paying for to cost of your operation, right? You have to look at all of that things. That two things that I'm always looking for is, yeah, you can pay the taxes, six figure of taxes, or spend six figure of cost to operate your business. But is that making you really sleep at night well, right? Is
Right.
that really instead of I mean, I don't want to be too political here, but sometimes the taxes that you pay to the government, sometimes you are not agreeing where they spend that money, that our tax money, right? So why not divert that to your own financial planning so you can control that planning instead of paying Uncle Sam. You put it and establish a charity donation or a gift tax donation, or some kind of legacy planning that it will help not only the foundation or organization in your community to advocate for whatever they are trying to accomplish in that community. But you yourself, you can have some kind of planning to help not only yourself but help your employee and your community by controlling most of your money that you earn, and I think that's much more better than letting the government basically spend the money that you're not really fully agree where they putting it right now.
I think that is really important advice. And I really appreciate you coming on, Ronald, because it's really helpful to point out things that you see in your experience and how you serve your clients. And I really appreciate that. If someone is listening to this and wanting to learn more about you and how you serve people in your network and helping them plan for retirement for their practices, what's the best way that they can reach out and learn more and then also connect with you?
So basically, the best way is to connect with me is by emailing us and at info curious finance .com, right? So that's the way of it. But as maybe some of you are listening, not already knows me. I'm very active in the social media. We have LinkedIn, we have YouTube channels, and we have Facebook. So we have a lot of. I'm very active in the social media. So like I said, but the best way to reach out to us is to basically go to I mean to say is email us to info curious underscore finance.com.
Excellent. Well, Ronald, thank you so much for coming on today. It's been a real pleasure talking with you.
Thank you very much, Mike. Have a good day.
You've been listening to Influential Entrepreneurs with Mike Saunders. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.influentialentrepreneurssradio.com.